So like I said, let's start off with the therapist parts and their impact on the therapeutic relationship. And I just want to read you this quote. It is so important to know that when you encounter a problem in IFS, it's usually because a part is interfering. You don't know whose part it is, if it's the client's parts or your own parts as the practitioner. So if you're getting stuck, just remember that. Do I have to make this U-turn and recheck in with my parts? Have they given me enough space? Do I have enough self energy present to now focus on the work that I'm doing with this person? Most therapists make mistakes, and that's totally okay when they're applying or using IFS in practice. I just want to highlight some common therapist mistakes. And again, as a beginner therapist informed practitioner, you perhaps will be making these mistakes, and that's totally okay. But sometimes therapists become hijacked by their own parts, so that kind of like interferes in the work that you're doing with clients. Parts of you will take over you and will not give you enough self energy in that space to do the work with your clients. Like I mentioned before, working with exiles before the system is even ready to even let the exile show the history and speak and unburden, release all the burdens. Um, we discuss how not to take the bait when an exile shows if you haven't checked or done the work with the protected parts. So working with exiles at the first stage of this process is, I wouldn't say that it's forbidden, but it's not recommended. So first checking with the protected parts, managers and firefighters, and then you can transition to the work with exiles. Sometimes practitioners assume that they are talking to the client's self when they're actually talking to a self part. And those parts come mostly from controlling parts, trying to control the process, feeding the practitioner what they want to hear. So if that part is coming from a thinking space, it's because it has an agenda behind it. If that part comes from, or that energy comes from an open-hearted space, that's more of that self energy that your client is holding. So just try to remember that. If if it's coming from a logistical thinking space, that's a part. And you don't have to outwardly say, that's a part. Don't don't give me responses from that space. You don't have to say that, but you gently validate that part. It sounds like that part of you is coming more from a logistical or thinking space. I want you to recheck in with that. Let's see if that's your self energy, if that response is coming from an open-hearted space. You can say something like that to your client. If the therapist thinks that self is doing the work, but it's really a part, again, this is very common where, like you would think, oh my gosh, this client is holding so much self energy and they're doing the work. But it's actually a manager part of them that's been doing the work, that's been getting all the homework done, and they just want to be seen as a good client. There are parts that um, just want to be seen or want to show the client as I'm a good client, so I'm gonna do my therapeutic homework that you assign me, and every time I come to session, I'm gonna tell you what you want to hear. So again, recheck with the client, guide the client into the dropping in space, and recheck where those responses are coming from. Are they coming from a part with an agenda, or they're coming from an open-hearted space? Some of the most common therapist parts are like I said before, um, as practitioners, sometimes we want to work harder than our clients. And I'm pretty sure some of you um, can relate to that. In grad school, we learned that from different professors or mentors that we shouldn't work harder than our clients. What does that mean, right? So in IFS, that would mean let's recheck in. Let's do our U-turn. Let me see if I have a part that's activated that wants to do the work for my client, that maybe perhaps carries the agenda of I want my client to get better right away, soon enough that to show progress in some ways. This happens quite often when you work at a community mental health clinic or some other nonprofit space where you have to show progress. And if you're not showing progress in your clients, then that makes you like a not good enough therapist because your clients are not progressing or not making progress. So check in with your striving managers because those can become highly critical of the process and the practice that you're doing with your clients. Approval seeking managers that want clients to depend on you, they worry about not being liked. Sometimes, as beginner therapists or student therapists, I've noticed that you want your clients, and this happens to all of us when we first started doing clinical work, that we want our clients to like us and we want them to come back. And sometimes beginner therapists have approval seeking managers that will lead to the practitioner or you as the beginner therapist feel very drained and feel exhausted after your sessions because you're doing the work from maybe one of these parts. Pessimistic managers, when things are not going well, might tell the therapist to give up or blame the client. I've seen this quite often. And what I would say, again, recheck in. And even in supervision, you can bring this into your supervision and recheck in with those parts that are blaming the client for the progress that they're not making or that are blaming perhaps somebody else, your supervisor, the clinic, or the overall institution where you're at, or the organization where you're at. So these are quite present for student therapists. Um, Caregiving managers that want to take over for clients or need to rescue them. I feel like we're all in this field, in the health, not only healthcare field, but mental health field, because we like to help people. We care in some ways, right? We're not in this field for the money. We're in this field because we care. We're empathic beings. We're compassionate beings. We have compassion for others. But that sometimes brings a lot of caregiving managers that tend to get in the way as well. Um, Angry parts that can make the therapist impatient with clients and feel burdened by them. I don't know if you're in your experience, you've experienced these parts because, like I have supervisees that sometimes tell me, like that client makes me so frustrated. I can stand when they get on my schedule. I can stand when, like I need to see them and I don't know how to work with that. I hear that quite often. And that lets me know that perhaps that person needs to do a U-turn and really recheck in with that part that's present because that definitely gets in the way of you connecting and making your own self energy available in that space for that client and for yourself. Hurting parts that over identified with clients' pain. Again, I see this quite often too, where you've gone through your own personal experiences, little T or big T traumas, and your client comes with similar experiences as yours, and you feel that hurt for your client. It's like, oh, I'm feeling that coming up. Perhaps that's coming from your exile parts, right? And you might give space to your exiles part and over identified with your clients' own experiences that they're bringing into the space. So that kind of like so takes away the whole process of you just feeling clear and having self energy for your client in that moment. Evaluating parts that are critical of the therapist's own weight, eating habits, relationships, and also can stand those things in others. So, as I mentioned before, the relationship that you have with your parts internally is parallel to the relationship you have with other people's parts externally. So, just pay attention to those parts that might be evaluating your clients and their habits and what they do, because that's a reflection of your own internal experience with your parts. So in IFS, we have this concept of self-led, and that can be confusing at times. Uh, I have a lot of people ask me, what does self-led look like? What does that mean? So I just have like some bullets here, bullet points here, to kind of like give you an idea of what that looks like. But as a self-led therapist or practitioner, you will know when self is or isn't embodied, when that energy is present. You'll be sensitive to self energy in the room that's either shared by your client or your own self energy that you're sharing to them. You'll have techniques to help your own part step back quickly. And that's exactly what I mentioned before. When you're in sessions with your clients, you will be able to quickly drop in and do your own U-turn and check in with the parts of you that are showing up. And again, you can do this explicitly or implicitly. You'll be able to detect or know when typical therapist parts start to take over, when you feel that frustration because the client is not unblending enough, or you're spending too much time in that unblending process. A lot of these parts can show in those moments. So again, use this tool, the U-turn. Let's come back to centered. And I highly recommend you to, if you do it explicitly, just let your client know. Tell them, hey, I need to take a minute. You know what you just said landed with me in a different way. So let me just check in with myself before we continue. You can explicitly say that to your client, or you can do it implicitly. As they're talking, you can just drop in, take a deep breath in, and connect with that part. Just make a commitment to with that part to take care of that part maybe after your session or at some other time during that day. You will know how to make attempts to get interfering parts to step back, again, using that U-turn as a tool. You'll be honest and transparent with your clients. If you're doing your U-turns, you will explicitly say that. You'll be transparent with them if you're getting triggered or there are some trailheads during your sessions. You will use therapeutic ruptures as trailheads when you make mistakes or make a big boo-boo. You'll be honest and transparent. Hey, like I realized I made a mistake in our last session, and I really want to offer your parts and if they need any type of repair, and I'm here, I'm open to listen and what's the type of repair that they need. So use therapeutic ruptures as trailheads because you probably got activated and the client felt that and they made a decision or said something that continued to get you triggered, which is a big trailhead. Give permission for clients to point out if you're in a part. Not many practitioners do this, but I feel like this is a major tool to build relationship with your client and their parts and to join. I often tell my clients, hey, if this is landing differently in your system, and if you sense that I'm in a part or this is coming from a part of me, you're more than welcome to point that out to me. So IFS is not only a relational model, but it's a collaborative model. So you're collaborating, you're being authentic, you're being genuine, you're being transparent with your clients. Embrace the 5 Ps. I'm not going to say this enough, but the 8 Cs and the 5 Ps are something that we should all embrace as practitioners. And every time you walk into a session with a client, take 5 or maybe 3 minutes, whatever that is, to really go over those 8 Cs or 5 Ps. Make a commitment. I'm going to walk in more curious into this session today. I'm going to work more. I'm going to work with persistence because I'm not giving up on my client. Use the client's triggers as trailheads. When a client triggers you, that's automatically a trailhead. So in IFS, we don't use the triggering language, we say trailheads. So trailheads are very important to take care of post-session or post-practice. Often I encourage people to keep a journal of these trailheads so they can then take care of those trailheads in their own individual work or maybe bring them into supervision. The therapist's main job is to stay in self and to help client access their own self energy and the self of their parts. Parts have self energy too. Might be 1%, 0.5%, or maybe 0.2%. But parts can think about this spider web idea. Self is the center, and then parts do have at least a vein or something that is coming from that centered self energy, at least 0.2% of that. The therapist is a hope merchant. So after creating a contract with the part, we're providing authentic, genuine hope. Okay. This is where people sometimes get confused too. It's not that you're telling your client that they're gonna get better within the next week. You want to provide authentic, genuine hope to your clients. The therapist trusts in the client's self. If you trust that your client have the resources and the space or the self energy to do this work, that's half of the battle right there. You trust that this client can get better, can do the work. And that'll show in the clinical space. The client will feel that you trust in them, that you believe in them. And that goes back to the hope merchant aspect of this. You sharing that with your client, I trust in you. I trust that you have the resources necessary to get over this, to get to know your parts, to build a different relationship with your parts. That's a powerful statement. As practitioners, we tend to not just stay with the baton, but once we sense or know that there's enough self energy in our client's system, we pass that to them. And we do that throughout. Sometimes the client will pass it back to us and we'll have to do some direct access. But when they're in insight, you shouldn't be holding on to that baton. You pass it back to them because their insight and they're building their relationship with the parts. So I want to take a quick pause. So again, this reflection might take you 15 minutes or more. But what I'd like you to think about is your own parts, okay? When you're in it with clients, what are the parts of you, what are the parts that tend to be engaged when you work with clients? Once you make a list of those parts, or maybe pick a target part, I want you to pick either one or more than one, um, and take a minute to turn your awareness inside. And from this place of curiosity, ask the part what it's afraid of as you being the practitioner. What would happen if it didn't step in, if it didn't take over? What does it want you to know about the role that it does for you in that space? And how do you want to respond to the part? Now that you know and you understand self energy and what a self-led practitioner should embody or have in that space with clients, ask the part, what does it want you to do for it? And what does it want you to know? Is there something that it needs from you? And ask the part to show you either through a movie, pictures, memories, or to even tell you verbally. And after that, just think about a couple of self-care practices that you might want to do that might help this part step aside and just give you some space when you're doing this practice with clients. And that concludes our lecture.